Hello, my name is Zara Patel. I am a sinus and skull-base surgeon here at Stanford University School of Medicine, and I'm also a smell disorders expert. So I'm going to talk to you a little bit about smell loss after COVID-19 and how to know if you have it and treatment options and things like that. So there are a lot of different ways that smell loss can show itself after a COVID-19 infection. Some people lose their sense of smell and taste directly after they get the infection within the first 24 to 48 hours. And usually it's taste that happens first, and then they realize that it's because they can't smell, because about 80 to 90% of our ability to taste the flavor of our food is dependent on our ability to smell it. Then there are some people that don't lose it right away, but over maybe 3 to 4 months later, they then lose their smell and taste. And that's because of the natural regenerative cycle of smell nerves that occurs in your nose, where one nerve dies off and should be repopulated by new ones, but that doesn't always happen after this type of infection. So if you feel like you have lost your smell and taste, you should seek care right away, because the longer you go without smell and taste, the harder it is for us to be able to bring that back for you. Now, not all physicians, especially emergency physicians, urgent care physicians, or primary physicians, may be familiar with all the treatment options there are to bring back smell and taste after this type of infection, but there are some good treatment options out there. Those would include things like olfactory training. That's just a simple, structured smelling protocol to exercise your sense of smell again to come back. Then there are more technical things that your doctor could guide you through, like high-volume steroid irrigations or high-dose omega-3 supplementation. And then finally, there is now a procedure that we have recently studied called PRP injections. That stands for platelet-rich plasma, and it's something that we just draw blood from the patient themselves and spin it down and get this really good growth factor-rich portion of the blood, and we can inject it back into the nose where those smell nerves need it. So there are many treatment options available. You should try to find a smell specialist that might be familiar with those options. And then finally, if you feel like you have lost your sense of smell and taste after COVID, simply go and seek out the care of a doctor and they can guide you.